$2,100. That's the new ceiling on your Part D drug cost. After that, it's zero. If you're on Medicare or helping a parent who is, this cap could save you thousands. Since Part D began in 2006, there was no limit. You hit catastrophic coverage and you were still paying 5% of your drug costs forever. Let that sink in. Your pharmacy bills never stop. One law changed that. Now there is a ceiling, and I'm going to show you exactly how it works. So in the next 10 minutes, you'll understand this cap better than 90% of the people trying to explain it. What it is, what it isn't, and exactly what to do this week. I'm Hanh Brown, and this is where AI, policy, and aging collide, and where your family fits into all of it. See, now, most people hear $2,100 cap and think, well, I'm protected. But here's a question they don't ask. Protected from what? And how do you pay until you hit it? Well, that's where the confusion starts. And that's what we're going to clear up right now. The official guidance on this cap is over 100 pages. Nobody expects you to read it, so I did. Let me show you what actually matters. 3 things make this hard to understand. First, multiple names. You'll hear Prescription Payment Plan. You'll hear out-of-pocket cap. You'll also hear IRA drug provisions. Same thing. Different words. Nobody uses consistent language. And second, phase rollout. 2024 brought the first changes. 2025 introduced a $2,000 cap. 2026 indexes it to be $2,100. 3 years, 3 sets of rules. Old articles are already outdated. Third, overlapping program. Extra help, Medicare Advantage, Medigap, standalone Part D. Each interacts with the cap differently, and nobody explains which rules apply to you. So no wonder people give up. But here's the truth. The core concept is simple. The complexity is in the exception, and most people don't need the exceptions. So I'm breaking this into 4 parts. What the cap is, what the payment plan is, who qualifies, and what happens if you have extra help. So part 1, what is the out-of-pocket cap? In 2025, Medicare introduced an annual limit on what you pay out of pocket for covered Part D drugs. That limit was $2,000. In 2026, the cap is indexed for inflation. The new limit is $2,100. So once you hit that number, $2,100 in 2026, you pay $0 for covered Part D drugs for the rest of the calendar year. So that's it. That's a core protection. Well, this is the part that used to hurt. Before this cap existed, Part D had 4 phases and no ceiling. So phase 1, the deductible. You paid 100% of your drug costs until you hit it. Phase 2, initial coverage. After the deductible, you typically pay 25%. Your plan paid 75%. Phase 3, the coverage gap, the donut hole. You paid a larger share. People with expensive medications watch their out-of-pocket spending spike. Phase 4, catastrophic coverage. Even after spending thousands, you were still paying 5% of drug costs. No limit, forever. That old system is gone. The Inflation Reduction Act eliminated that endless 5%. Now, once you hit the annual cap, $2,100 in 2026, your cost sharing stops immediately. 0, not 5%, 0. So the cap applies to your deductible, co-pays, and co-insurance for covered drugs. That's straight from Medicare's own guide. Once you hit the limit, you pay nothing more for the rest of the year. So this is now in effect. The 2026 Medicare cost fact sheet from CMS confirms this. And if you take expensive medication, let's say cancer drugs, MS treatments, biologics, specialty drugs that cost thousands per month, this protection could save you thousands every year. So I break down the exact math in the next video of the series. So for now, remember one number, $2,100 maximum in 2026. After that, your Part D drugs are covered at zero cost for the rest of the calendar year. So far, here's the only thing you need to remember. There's now a ceiling, $2,100. After that, zero. All right, so there's Part 2. So what's the payment plan? Well, this is where the confusion starts. The cap and the payment plan are two different things. The cap is automatic. You have Part D, you're protected. You don't have to do anything. The payment plan is optional. It lets you spread out your out-of-pocket costs across monthly payments instead of paying everything at the pharmacy counter. So this is the January trap. Say you have rheumatoid arthritis. You take biologic that costs $1,800 out of pocket in January. Without the payment plan, you walk into the pharmacy on January 3rd and you owe $1,800 that day. With a payment plan, you spread that $1,800 across monthly payment. So instead of one massive bill, you get manageable monthly accounts. So the payment plan doesn't save you money. It saves you from the January surprise. One massive bill becomes predictable monthly payment. Well, here's the critical point. You have to opt in. The payment plan does not automatically enroll you. The cap is automatic. The payment plan is not. And if you want monthly payments, you need to contact your Part D plan and actively enroll. So quick question. Did you know the cap and the payment plan were two different things? Drop it in the comments. I want to know how many people just learned this. Well, so far, the cap is automatic. The payment plan is optional. That's the foundation. So now, who actually qualified? And what happens if you're on extra help? These next two parts answer the questions I get most. Part 3, who qualifies? Well, everyone with Part D. So read it again. Everyone. The out-of-pocket cap applies to every Part D beneficiary in America. No application, no income test, no asset limit. If you have Medicare Part D, whether standalone or through Medicare Advantage, you're protected by the cap. The payment plan is also available to everyone with Part D, but again, you have to opt in. So this isn't like extra help where you have to qualify based on income. The cap and the payment plan are universal benefits. They apply to roughly 50 million Americans. So not every plan handles enrollment the same way. Some implemented the payment plan quickly, some are slower. The good news is no interest, no fees for participating in the payment plan, but you do have to pay your monthly bill on time. So that's why my first action step is call your plan directly. Don't assume anything. Confirm how they handle payment plan enrollment. Part 4. What if you have extra help? The low-income subsidy is a separate program for people with limited income and resources. If you qualify, you already pay very little for prescriptions. Sometimes a few dollars, sometimes nothing. So you may qualify if your income is limited, roughly in the low 20,000s for an individual, low 30,000s for a couple. Resource limits apply too. These numbers change each year, so check the Social Security Extra Help page or call the SSA for current limits. If you're on extra help, the out-of-pocket cap still applies. It's a backup protection, but you're probably already paying far less than $2,100 per year. The payment plan probably won't matter much for you either. If your costs are, let's say, $10 or $20, spreading them doesn't make a difference. But here's what matters. This is who the cap really protects. If you're just above the income limit for extra help, if you make a little too much to qualify, the out-of-pocket cap is your safety net. You might not get extra help. You might still get the cap. And the payment plan can help you budget those costs across the year. This isn't about memorizing policy. It's about knowing you have a ceiling. For the first time in Part D history, there's a number where it stopped. That changes everything. I made a full video on extra help in this series, who qualifies, how to apply, and why roughly 3 million people who are eligible haven't signed up. And if you think you might qualify, that's the one to watch. So let me pull this together. The out-of-pocket cap is your maximum. The payment plan is how you pay it. One protects you from catastrophic costs. The other gives you flexibility in managing those costs. The cap started in 2025 at $2,000, and now it's $2,100 in 2026. It applies automatically to everyone with Part D. The payment plan requires opting in. That 100-plus page guidance document, well, you just learned the 90% that actually matters. A year from now, you'll either be glad you understood this or standing at a pharmacy counter wondering why nobody explained this. Well, here's what you do this week. 3 things. 1, call your Part D plan. The number is on your plan card. Ask them, how do I enroll in the Medicare Prescription Payment Plan? When does enrollment need to happen? So get that answer now. Don't wait until later in the year with a big bill and no way to spread it out. 2, estimate your 2026 drug costs. Look at what you paid in 2025. Add up your deductibles, co-pays, co-insurance, and if the total was more than $2,100, you're going to save money this year. If it was less, you're still protected, because if something changes, the cap is there. 3, mark October 15 on your calendar. That's when the annual enrollment period opens for 2027. And if your current plan isn't working, premiums too high, drugs not on the formulary, pharmacy not in network, October 15 is when you can switch. I made a full timeline video. It's a series that walks through every deadline. Here's what this comes down to. This is your money. You paid into the system. The $2,100 cap is real protection, but only if you understand how it works. Well, the system won't explain this to you. I hope this video did. So now you know, and knowing changes your position. Most people only learn this when they're standing at the pharmacy counter with a bill they can't pay. You don't have to be one of them. So bookmark this video. When enrollment season hits, you want this breakdown in front of you. So if you know someone who's been confused about this, a parent, a spouse, or neighbor losing sleep over prescription costs, send them this video. They deserve to understand what they're entitled to. So the next video covers the 6 gotchas nobody's talking. Premiums that don't count toward the cap, drugs that aren't covered, and what happens if you switch plans mid-year. And if you want to go in with eyes open, that's the next video. I'm Hanh Brown, and this is The Hanh Brown Show. I'll see you in the next one.